Good morning, ladies and gentlemen. I am honored to be a part of IIOR event for the third consecutive time. I pray for Allah for all of you to be good and save you from COVID-19 pandemic. My lecture will be entitled Root Canal Retreatment of Two Rooted Mandibular Second Premolar with Multiplanar Severely Curved Canals. Content of the lecture will be a brief introduction, some history about endodontics, case presentation, and summary. Why it's important to save the tooth? Because there is no synthetic material till now that can substitute the tooth tissue and or the supporting structure 100% efficiently. The best substitute for the tooth would be dental implant. However, dental implant lacks some points that only natural tooth can offer. For example, as you can see in this photo, the soft tissue attachment with the natural tooth, some soft tissue attached to the bone and some attached to the root of the tooth. However, in implant there is no such fibers that attach the gum with the implant, only attached to the bone. Therefore, periodontal problems will be less in tooth compared to implant. Besides, the sensibility in implant, as we all know, it's not sensible, and aesthetically the tooth looks better than implant in most of the cases. To treat a difficult case, we have three pillars that enables us to deal with such cases. First is knowledge and creativity. The operator should have the mind that can adapt and ideas that help him with the case and deal with each case, let's say, different than other cases. The second point would be the art. The operator should have a good manual dexterity that enables him to perform difficult management protocols. Besides, materials and equipment that will make our life easier if we have a modern and some equipment that enables us to treat difficult cases and do something that would be impossible to do without such equipment. History. There are some cornerstones in the history of endodontics. In 1838, yes, the endodontics is not a modern dental branch. It's very old. It belonged to the 18th century. In 1838, Edward Maynard, the first one who used endodontic hand instruments. In 1892, Ultramare described the rotary devices. In 1889, William Rollins used the first one who used endodontic handpiece. In 1957, Richman described the use of ultrasonics in endodontics. However, it's never used till 1976 by Martin et al. In 1988, Wally et al. Used nickel titanium alloy in endodontics, and in 1997, dental operating microscope first used in dental office. It was used only for researches. However, in 1997, it's used in dental office. Let's go through the case. Mandibular second premolar, as you can see in this radiograph, referred for me for root canal retreatment. It was obturated only with sealer, as you see in the radiograph. I asked the patient to take CBCT imaging. After CBCT imaging and analysis, we can see the tooth has two roots. It splits apically with severely curved canals, distally curved canals, and roots, of course. That makes the case very difficult for endodontic management. However, I accepted the challenge. First, I started with isolation. The obturation was done, which was a piece of cake because it's obturated only with sealer. And started to do canal negotiation. It was very tough job. It took about more than an hour to reach the full working length. Unfortunately, I couldn't take a radiograph for the full working length with the file inside the canal. Working length estimated with the electronic apex locator and canal shaping done with the rotary instrument. Thanks for the nickel titanium and heat treated files. Confit, as you can see in this radiograph. After about 4 hours, I could reach such a step of confit. I did a copious amount of irrigation with activation, of course. I did the activation using eddy tip with sonic scaler. I couldn't risk using ultrasonic tips, metal tips. I was afraid for the tip to be fractured and complicate the case. So I used this eddy tip, which is made of polymer. Fortunately, it wasn't a break inside the canal. However, even if it was a break inside the canal, it would be easy to remove it. I applied the sealer only inside the canals after the split for the first step. I used Age Plus sealer from Dentsply. Then I did the obturation. Obturation done using continuous wave technique. I obturated each canal split separately, inserted a master cone, and did a down pack till the split of the canal. Then repeated this step for the other canal, as you can see in this photo and radiograph. Continuous wave obturation done with this device, EQV from Meta Biomed. Then the rest of the canal obturated with injectable gutta-perca, which this step is called backfilling, done with this device, this gutta-perca gun, also from Meta Biomed. And here is the final result, as you can see, comparing it with the preoperative radiograph. All the treatment took about, including the restoration, took about more than 5 hours in 3 sessions. However, it was worthy to do such treatment because the difficult cases gives us the confidence about next cases. As a summary, tooth conservation is multidisciplinary. It's a matter of art, knowledge, and creativity. It's important to do proper diagnosis. Diagnosis is very crucial to be considered, especially in trying to make a treatment plan. So we can expect any difficulty that we may face during the management. The best combination of managing difficult cases are knowledge, manual dexterity, and patience, especially in endodontics. Patience is very, very important from the operator and from the patient himself. Finally, natural tooth is better than prosthetic because it's harmony with the surrounding, and of course because it's made by Allah Almighty. Thank you for your patience and listening. I'm glad to receive any question. Thank you so much.